Welcome to 5 Stone. Prepare, respond, serve. At 5 Stone, we bring you years of experience from law enforcement, former military, combat instructors, licensed medical providers, first responders, to motivate you, to help you become more prepared. So get ready for product reviews, interviews with the professionals, hot topic discussions, to help you be ready for what this world can throw at you. So welcome to 5 Stone. Let's go. Hey guys, Eric and John here with 5 Stone. This is the third video in our series in medical care on the range. So if you haven't watched the first 2 videos, recommend going back and watching them. It kind of builds up to this. We've gone through some first aid kits and packs and went over some general safety just to protect yourself while you're out in the range. Now we're digging into the packs and going through the individual items. And so John's going to go over, he's a paramedic, he's going to go over the use of tourniquets and some differences in some of the tourniquets out in the market.
So what I got here is a rat tourniquet. It's one of the cheaper options. Pretty simple. If you want to carry one on you every day, it's pretty easy to carry. You can throw it in your belt loops. Carry it, you know, kind of like a belt under an untucked shirt. Nobody ever see you got it. Pretty easy to use. Pretty self-explanatory. So basically, what we're doing is treating heavy bleeding. You know, not necessarily arterial bleeds, but any kind of bleeding you cannot control. You know, do not hesitate on using a tourniquet. There's a lot of old myths out there that they're that you lose a limb. It's just not true.
Lose a limb or bleed out and die, whichever one you want. If you have, for example, a femoral artery bleed, okay, you can bleed to death in 3 minutes. So that shows you the importance, okay?
Very important.
Should I use this tourniquet? Well, they might lose their leg. You're going to be dead in 3 minutes. So yes, use a tourniquet if you have to.
They've had soldiers wear these things like 10 to 12 hours before they get to a hospital, and really no deficits at all. And you got
to look at the sacrifice if you don't use it, you know. So
this one's pretty easy.
Let's say I got a bleed up here that we can't control.
Yep. So you always high and tight. So get a tourniquet as high as you can get it. And with these, pull it tight. It's a bungee cord, and you just start wrapping. And you kind of want to create a fat wrap, okay?
You call me fat? Come on, man.
I get them fat wraps though. and you get an alligator clip here. It doesn't require any tape, nothing else. Just kind of cinch it in there real good.
And that's it.
And that's it.
You can check for the pulse down there to see if you got blood flow going down.
Yep, no pulse.
So he's totally occluded off that artery. So if my bleeding, you want to usually get at least a couple inches up above.
Yep.
If it's a laceration, for example, let's say something happened, I got a knife cut or laceration right in through here. All right, and we hit those arteries and I'm bleeding out, maybe it's down here. Okay, at least want to be a couple inches above, and you don't want to put over a joint or a bone because you're not going to be able to compress the blood flow and stop it.
So. Biggest thing is, like, if you completely sever a vessel, you know, they can retract up into that limb, and you don't know how far that's gone up in there. So you want to get as high and tight as you can get
to get above that retracted vessel.
Easy to take off. You should never loosen these until they get to the hospital. That's a doctor's job. Okay. It's gonna suck. The patients hate them, but they save lives.
Yeah, I've used them before too, and they're awesome. Other ones we got the cat tourniquets. Okay, these are like, you know, tried and true, been around for a long time. CAT tourniquets, combat application tourniquets. These are used in the military a lot. John, you can go through it, man. That's fine. You can. I got
this one. I probably prefer this style more than any of them. I've got another one I'm gonna go over here in a minute. These have just been, like you said, tested and proven that they work wonders, and they're super easy. You always want to carry them on you. They come in a little cellophane wrapper. Undo it, carry them, and set them up to where they're ready to put on. And
these are designed so you can put them on yourself.
Yeah.
Like I carry mine, you know, usually attached here. If I got my other medical kit here, I put it on the side. You can actually grab it, and it's made to put on one hand.
Like one hand, so. and apply it that way. Yeah. I'm gonna put this on Eric, kind of same position here. But basically just cinch it as tight as you can get it. Wrap that around there.
Now that doesn't feel too tight, but he's fixing to tighten it up, and you'll see how.
Tighten this.
It's called a windlass.
Yeah, this windlass until you can't tighten it anymore. Woo! It sucks. It's very painful.
Yep.
Okay. And you got to put it in this little clip right here to hold it. And you seal it like that, and you can write the time of your application.
And if you had to, you can bring that back through there so that's not hanging.
Yeah, exactly.
Inside of this if you need to.
Yeah.
If you're worried about it getting caught on, you know, EMS and fire and everybody's like Velcro kings, you know, so it can get stuck. So you can fold it back there as many times you need to.
Yep.
And write your time that way.
They're super effective. you know, no blood flow there at all. They're easy to put on under stress.
Yeah.
I love them.
And again, this is just like a firearm. Anything that you're going to have your gear and your supply, you need to practice with it. You need to know how to put it on and spend the time, you know, become proficient with that tool. So
Yep.
that's just another piece of equipment to add to your
Not only that, but if you got kids, you know, teach them how to use a tourniquet.
Yeah.
You know, if something happens to me while I'm at home,
Yeah.
Mowing the yard or something, you know, something happens and I need some bleeding control, you know, my kids,
Yeah.
they know how to put a tourniquet on.
You know, and you got, and let's just say this is in case there are some people out there that just don't know. These are made for application on the limbs only. Okay. Hopefully people would know that, but you never know.
Yep.
There might be somebody out there, you know, somebody watching just has no idea. For example, if I got an arterial bleed get squirting out of my neck, I'm not going to wrap a tourniquet around my neck and squeeze it off tight because I'll be dead.
We will go over that though.
Yeah, but we're going to go over and show you how to treat that. And actually, we can probably do it coming up here. I'm about the next video, but here, one of the videos soon.
Yeah, there's other tourniquets out there besides what we've gone over.
Yeah.
You know, there's a soft T, there's the new
Recon. Yeah, they're bad.
Pretty
too.
much
I
identical
like
to a cat.
But I
cheaper.
did a couple things, new things on them. I really like them. So
Yeah, they do
yeah.
some upgrades, yeah, and I like them.
I have one, but I forgot to bring it with me today. You know, it's in my other medical kit.
Same
in the car,
application
so.
as a cat though.
Yeah. So anyway, that's your tourniquets. All right, and watch the next video. We're going to continue to dig in these bags. All right, you ready?
Yep.
Let's go.
Let's get it.